Welcome, good morning everybody, and I'm very happy to meet all of you once in 10 days. And this is a repetition class, but it will be giving you a lot of awareness about the management of hyperlipidemias and the consequences of hyperlipidemias, particularly about the coronary arterial disease. So for this, we have to get acquainted with the basic things about lipid metabolism. So pretty well, lipids are heterogeneous group of hydrophobic organic molecules that can be extracted from tissues by a non-polar solvents like chloroform, ether solvents. Common classes of lipids are fatty acids, triglycerides, phospholipids, glycolipids, and steroids. So they are insoluble in aqueous solution, water-based solution, they are insoluble. So body lipids are compartmentalized as membrane-associated lipids, droplets of triglycerides in adipocytes, or transported in plasma with proteins. This is the commonly asked Viva question. The external examiner will ask you by initiating, you know pretty well that the lipids are insoluble in aqueous solutions. How the body lipids can be managed by the body. Then you have to tell, sir, the body lipids are compartmentalized as membrane-associated lipids, droplets of triglycerides in adipocytes, or transported in plasma with proteins, that is lipoproteins. Finally, the discussion will go with lipoproteins. If they are quite happy, they will stop the things with chemistries only, otherwise they will take it to the metabolism. So lipids provide hydrophobic barrier, permitting partitioning the aqueous contents of the cell and the subcellular structures. Lipids are major source of energy. Pretty well 9 kilocalories per gram. So fat-soluble vitamins have regulatory or coenzyme function. Prostaglandins and steroid hormones, they control the body's homeostasis. Imbalance of lipid metabolism will lead to atherosclerosis or obesity. We will also try to learn about these two things in this class. Average daily intake of lipids by adults is 81 grams, out of which 90% is triglycerides, and the remaining is cholesterol, cholesterol esters, phospholipids, and non-esterified free fatty acids. And these are all the structures. So processing of dietary lipids in stomach is the first thing you have to learn. And digestion of lipids begins in the stomach, catalyzed by acid-stable lipase. You know about lingual lipase. So at the back of the tongue, lingual papillae, they will be producing the acid-stable lipase. Triglycerides containing short or medium chain fatty acids of less than 12 carbons will be found in the milk fat, and they are the primary targets of lingual lipase. That's why చిన్న పిల్లలు నోట్లో వేలు పెట్టుకుని అలా చప్పరిస్తూ ఉంటారు. వేళ్ళన్నీ కొరికేస్తుంది, పాడైపోతున్నాయిరా బాబు, పుండు అయిపోతుందిరా బాబు అని తిట్టినా సరే నోట్లో వేలు పెట్టుకోవడం మానదు. చాలా లింగువల్ లైపేస్ ప్రొడ్యూస్ అవుతూనే ఉండాలి. సో పాలు తాగినప్పుడల్లా వెంటనే లెస్ దాన్ 12 కార్బన్స్ ఫ్యాటీ యాసిడ్స్ ఉంటాయి కాబట్టి మీడియం చైన్ ఫ్యాటీ యాసిడ్స్ మిల్క్లో అవన్నీ ఒక డైజెస్ట్ అయిపోయి వాటి నుంచి బోల్డ్ ఎనర్జీ వచ్చి బేబీ ఆడుకోవడానికి, గొడవ చేయడానికి, ఏవో పిచ్చి పిచ్చి మాటలు సరదాగా మనందరినీ ఆడి నవ్వించడానికి కావాల్సిన శక్తి జనరేట్ అవుతుంది. సో ట్రైగ్లిసరైడ్స్ ఆర్ ఆల్సో డిగ్రేడెడ్ బై సెపరేట్ గ్యాస్ట్రిక్ లైపేస్. సో గ్యాస్ట్రిక్ లైపేస్ ఇస్ సెక్రెటెడ్ బై గ్యాస్ట్రిక్ మ్యూకోసా. గుర్తుపెట్టుకోవాలి, 3 లైపేస్ల పేర్లు చెప్పమని అడుగుతారు. మాకు ఒక లింగువల్ లైపేసే తెలిసింది, మాకు ఒక ప్యాంక్రియాటిక్ లైపేసే తెలిసింది అంటే కుదరదు. 3 చెప్పగలగాలి. అందుకోసమే ఎన్నిసార్లు రిపీట్ చేస్తున్నా ప్రతిదీ కొత్త. సో ఫస్ట్ ఈస్ అట్ ద బ్యాక్ ఆఫ్ ద టంగ్, లింగువల్ పాపిల్లే నుంచి లింగువల్ లైపేస్ వస్తుంది. సో రెండోది gastric lipase. So మూడోది pancreatic lipase. So మూడు lipase వస్తాయి. The pH hormone for lingual and gastric lipases are 4 to 6. You know pretty well the gastric lipase should work inside the acid medium. HCl ఉంటుంది కదా, సో HClది 2 నుంచి 4 దాకా యాసిడ్ pH. సో 6 కొంచెం బైకార్బోనేట్ కలిసిన తర్వాత అంటే when it is mixed with secretions from pancreas, then they will tend to convert up to 6 pH. Acid lipases play important role in lipid digestion in neonates, for whom milk is the primary source of calories. Milk తాగి బ్రతుకుతారు వాళ్ళు. మీకు తెలుసు చాలా మంది పెద్దవాళ్ళు కూడా ఇప్పటికీ కూడా మిల్క్ తాగి బ్రతికిన వాళ్ళని అప్పుడప్పుడు మనం వింటూ ఉంటాం. మిల్క్ తప్ప ఆయన ఏమి తాగండి, ఎలా బతుకుతున్నాడో 5 సంవత్సరాలు 60 ఏళ్ళు 70 ఏళ్ళు వయసు వచ్చినా మిల్కే తాగుతాడు, ఏమీ తినరు ఆయన అంటూ ఉంటాం. సో అలాగే చిన్నపిల్లలు 5 ఏళ్ళు 6 ఏళ్ళు వచ్చినా సరే ఇంకా మిల్కే, ఇంకా ఏమి తిట్టినా కొట్టినా సరే అన్నం కానీ సాంబార్ కానీ రసం కానీ పప్పు కానీ ఏమి అసలు వేసుకోవాలి, వెజిటబుల్స్ కానీ ఏమీ తినరు. సో దిస్ ఈస్ ద థింగ్ దట్ యూ హ్యావ్ టు రిమెంబర్ హౌ the milk is the main source of primary source of calories for the neonates and the small children. And here one more application. There are some people with CF, pancreatic insufficiency. So for them, the 2 acid lipases are important digestive enzymes. వాళ్ళకి pancreatic lipase ఉండదు కాబట్టి lingual lipase, gastric lipase వాళ్ళకి దొరుకుతుంది. దాంతో వాళ్ళు మేనేజ్ చేయాలి డైజెషన్ అంతా లైపిడ్స్ అన్నిటిని. సో రిమెంబర్ సిస్టిక్ ఫైబ్రోసిస్ is the disease. CF అంటే cystic fibrosis. So for the people with cystic fibrosis, pancreatic insufficiency will be there. So వీళ్ళకి ఈ lingual lipase, gastric lipase ఈ రెండు మాత్రమే digestive enzymes. So almost near total absence of pancreatic lipase will be there for cystic fibrosis. Cystic fibrosis of pancreas. Remember. So cystic fibrosis is a most lethal autosomal recessive genetic disease in Caucasians of Northern Europe ancestry, and the prevalence is 1 in 3,000 live births. So in India, there are people, they survived up to 20 years. నాకు తెలిసినంత మటుకు one Christian family in South Africa. So disease is caused by mutation to the gene for cystic fibrosis transmembrane conductance regulatory protein that is known as CFTR protein. So remember what is CFTR protein? Cystic fibrosis transmembrane conductance regulatory protein is known as CFTR protein. There is a gene for this protein, and if the gene mutations are taken place, then they will have this problem. So defective CFTR results in decreased secretion of chloride and increased reabsorption of sodium and water. దాంతో వాళ్ళకి ఎక్కడ శరీరం మీద వీక్కున్న చెమట పట్టిన జిడ్డుగా ఉంటుంది అనమాట. జిడ్డులో పోవడంతో రీఅబ్సార్ప్షన్ అయిపోయిన సోడియం అంతా వస్తుంది అనమాట. సో వాళ్ళ వేళ్ళు ఫింగర్స్ తాలూకా గోర్లు లోపల there will be a lot of sodium. So we will clip the fingernails and we will collect it in triple distilled water, and then we will analyze it for the presence of chloride. This is what I have done in Madurai Medical College. So still today they are doing that process only, Satyanarayana CFTR process. So in the pancreas, the decreased hydration results in thickened secretions, and pancreatic enzymes do not reach intestines. So this will lead to the pancreatic insufficiency. So you should be able to explain this to the examiner. So you remember all these 4 points. So for them, enzyme replacement therapy is the only source, but that's also not of full benefit, some benefit, that's all, some use. So enzyme replacement therapy is of some use. So remember, I need not repeat it. So I have emphasized the importance of this knowledge. You have to learn it. So emulsification of dietary lipids takes place in small intestines. So critical process of emulsification occurs in duodenum. Emulsification increases the surface area of hydrophobic lipid droplets and facilitates the action of digestive enzymes at the interface of droplets and their surroundings. This is one thing you have to remember about emulsification of fat droplets. Emulsification is accomplished by two complementary mechanisms: use of detergent properties of bile acids and mechanical mixing due to peristalsis. So gastric peristalsis. Anything will be thoroughly mixed by gastric peristalsis. Bile salts are made in liver and stored in gallbladder. Hepatic bile is 1500 ml per day. So all this thing will be completely thickened in the process and reduced to 50 ml to 75 ml of gallbladder bile. So that will be having a lot of mucus. Whereas hepatic bile will not have any proteins. Mucus gani, proteins gani, any one of hepatic bile, 1500 ml per day. Whereas when it is condensed by gallbladder, then it will be coming down to 50 ml, maximum 60 ml, that's all. They will be having a lot of proteins. So they are derived from cholesterol and consist of sterol ring, a side chain, to which a molecule of glycine or taurine is covalently attached by amide linkage. The linkage guరించి అడుగుతారు. అలాగే టారిన్, glycine వీటన్నిటి గురించి అడుగుతారు. So dietary lipids then becomes smaller and it's not aggregated. Dietary triglycerides, cholesterol esters, and phospholipids, they are enzymatically digested by pancreatic enzymes, and the secretion of which is hormonally controlled. So triglyceride molecule is too large to be taken up by intestine and villi. So they are acted upon by esterase, that is pancreatic lipase. What it does, it removes fatty acids from first and third carbons. The primary products of hydrolysis are a mixture of two monoacylglycerols and free fatty acids. Pancreatic lipase enzyme is found in high concentration in pancreatic secretion. In severe pancreatic insufficiency, like cystic fibrosis, it results in malabsorption of fat. So fat cannot be absorbed. That's why they will not have normal growth. అసలు నిల్చునే ఓళ్ళు కూడా ఉండరు వాళ్ళకి, అలా కాళ్ళ మీద సపోర్ట్తో నడుస్తారు. అంతే, చిన్న ఎలక్ట్రికల్ చైర్ కూడా వాళ్ళకి ప్రొవైడ్ చేస్తారు. Second protein is co-lipase. It is secreted by pancreas and binds lipase in 1:1 ratio and anchors it at the lipid aqueous interface. So this brings about conformational changes in the lipase. So unless and otherwise co-lipase is there in 1:1 ratio secreted by pancreas, this conformational change will not occur for lipase. Then after this conformational change occurs, the active site is exposed. So co-lipase is secreted as zymogen, pro-co-lipase, and that is activated in the intestine by trypsin. You have to remember all these connections. Now remember the application. Orlistat is an anti-obesity drug that inhibits gastric and the pancreatic lipases, thereby decreases the fat absorption, resulting in weight loss. భయంకరమైన వెయిట్ ఉన్న వాళ్ళకి మొట్టమొదట మనం we have to apply Orlistat. Orlistat 150 milligrams పెద్దవాళ్ళకి. So Orlistat 150 milligrams is there. It's an anti-obesity drug. Central obesity, android obesity, gynecoid obesity, ఏ obesity అయినా భయంకరంగా చూడటానికి కష్టంగా బ్రతుకుతారు పాపం వాళ్ళు. అలాంటి వాళ్ళకి Orlistat అనే క్యాప్సూల్ రూపంలో దొరుకుతుంది, బట్ వెరీ కాస్ట్లీ. About 6 capsules are about 400 rupees. So orlistat is the drug name, trade name. It's an anti-obesity drug. How it works? It inhibits the gastric and pancreatic lipases. Rendu potai. Thereby decreases the fat absorption, resulting in weight loss. Now, CE, cholesterol ester degradation. Most of the dietary cholesterol is present as free or non-esterified form. So 10 to 15% is present in esterified form. Cholesterol esters are hydrolyzed by cholesterol ester hydrolases. So they are known as cholesterol esterases. So it results in cholesterol and free fatty acids, FFA. Cholesterol esterase activity is greatly increased in the presence of bile acids, bile salts. Now, phospholipid degradation. Pancreatic juice rich in proenzyme of phospholipase A2 is activated by trypsin and requires bile salts for optimum activity. Phospholipase A2 removes one fatty acid from C2, C1, C3 with separation. ఇప్పుడు C2, second carbon is ఉండేది fatty acid attached to second carbon. That will be done by phospholipase A2, leaving a lysophospholipid. So phosphatidylcholine is a predominant phospholipid during digestion and becomes lysophosphatidylcholine. Remaining fatty acid at C1 can be removed by lysophospholipase, leaving glyceryl phosphoryl base that may be excreted in the feces or further degraded unabsorbed. So pancreatic secretion of hydrolytic enzyme is hormonally controlled. Cells in the mucosa of jejunum and lower duodenum produces a small peptide hormone, cholecystokinin, CCK, otherwise known as pancreazymin, that is in response to the presence of lipids or partially digested proteins entering the upper small intestine. Other intestinal cells produce another small peptide hormone secreted in response to low pH of acid chyme entering the intestine. Then once the acid chyme enters the duodenum, the pancreatic secretions which are rich in bicarbonate will be lowering the acid pH. So that is the intestinal cells produce another small peptide hormone secretin in response to low pH of acid chyme entering the intestines. So secretin causes pancreas and liver to release water-rich bicarbonate to neutralize the pH of intestinal contents to be acted upon by pancreatic enzymes. So free fatty acids, free cholesterol, and 2 monoacylglycerols are the primary products of lipid digestion in the jejunum. Along with this, bile salts and fat-soluble vitamins form mixed micelles. These mixed micelles are dish-shaped cluster of amphipathic lipids with hydrophobic groups inside and hydrophilic groups outside. So mixed micelles are soluble aqueous environment of intestinal lumen. So these particles approach the primary site of lipid absorption, that is the brush border membrane of enterocytes, that's known as mucosal cells. So this membrane is separated from the liquid content of intestinal lumen by unstirred water layer that mixes poorly with the bulk fluid. The hydrophilic surface of micelles facilitate the transport of hydrophobic lipids through unstirred water layer towards brush border membrane where they are absorbed. I'm reading it so cautiously because you should be able to understand the application part of it. Coming to that, we are coming to that now. So cholesterol is poorly absorbed by enterocytes. So we got one more drug in market, Estim. It is not pronounced as Ezitimb, but it is, the spelling is Ezitimb, but it is pronounced as Estim. Estim is the medicine that can be further reduce cholesterol absorption in small intestine. That's why in hypercholesterolemias, a stim tablet is useful, very costly, to reduce the absorption of exogenous cholesterol. తిండి తగ్గించడానికి అవకాశం ఉండదు, అన్ని తినాలని అనుకుంటారు పాపం వాళ్ళు, తిని చేస్తారు. సో తిని చచ్చే మనస్తత్వం గల వాళ్ళకి we have to ask them to buy a stim tablet, IZTB tablet, and that tablet is useful to reduce the absorption of exogenous cholesterol that is consumed with the diet. So remember this application, most important. You can really save the lives in any families. So in East Godavari and West Godavari districts, and for that matter even in the Srikakulam districts, we have the Kshatriya communities. In their communities, the familial hypercholesterolemia runs in the communities. And most of the people will have death in the third decade itself. Third decade to పెళ్ళైపోతే పిల్లలు పుడతారు పాపం. The wife will come with a lot of dreams, the new life, and all the dreams will be smashed to the dust by the death of the husband, who is in a prospective way earning member of the family. So remember, these are all the application parts of lipid metabolism. At every stage I am stopping and trying to impress upon your minds, your own minds, so that you can be the sole savior of the families that you come across in the practice. So you know pretty well about the resynthesis of triglycerides and cholesterol and esters. I need not tell about this. So lipid malabsorption, this is one most important thing where we will come across lipoprotein B48. Short and medium chain fatty acids can be directly taken up by enterocyte without the aid of mixed micelles. So that's why they are given in dietary therapy for individuals with malabsorption disorders. Secretion of lipids from enterocytes, the newly synthesized triglycerides and the cholesterol esters are very hydrophobic and aggregate in aqueous environment, so they are packed as particles of lipid droplets surrounded by a layer of phospholipids and anesterified cholesterol and the molecule of characteristic protein, that is the cover, apolipoprotein B48. So this layer stabilizes the particles and increases the solubility and prevents coalescing. So they will not allow it to come together. Microsomal triglyceride transfer protein is essential for assembling of these triglycerides with apolipoprotein B containing lipoprotein particle in endoplasmic reticulum. So the particles are released by exocytosis into the lacteals. You know pretty well about the lymphatic vessels are known as lacteals, originating in the villi of small intestine. So what do you mean by lacteal? Lacteals are nothing but lymphatic vessels originating in the villi of small intestine. The presence of these particles in the lymph after lipid-rich meal gives it a milky appearance. So milky plasma వచ్చిందంటే lipid-rich meal తిన్న తర్వాత we have to think about this. So this lymph is called chyle, and the particles are named as chylomicrons. Chylomicrons follow the lymphatic system to the thoracic duct and then convey to the left subclavian vein, where they enter the blood. Remember all these anatomical details and biochemical details and physiological details. And now we have to think about this. Use of dietary lipids by tissues. Triglycerides contained in the chylomicrons is broken down in the capillaries of skeletal muscle and adipose tissues, and also in the cardiac muscle, lung tissues, and hepatic tissue. Remember all the 6 sites. So where the triglycerides are broken down, The triglycerides contained in the chylomicrons are broken down in the capillaries of skeletal muscle, adipose tissues, cardiac muscle, lung tissue, and hepatic tissue. So these are the 5 sites where they will be broken down. Triglycerides will be broken down from chylomicrons. So triglycerides in the chylomicrons is degraded to free fatty acids and glycerol by lipoprotein lipase. Remember, this lipoprotein lipase is synthesized by adipocytes and muscle cells. That's why the people who always run and jump and do active exercise, ఏదో అమావాస్యకి పున్నంకి ఒకసారి ఎక్సర్సైజ్ చేస్తే కుదరదు. We should have a regular habit of doing muscular exercise. So అలా చేసిన వాళ్ళకి మాత్రమే the lipoprotein lipase is activated and kept in constant concentrations to tackle with this hyperlipoproteinemias. ఎప్పుడో ఒక మారు ఏదో 15 రోజులకు ఆదివారం పూట ఏదో అలా కుర్చీ ఎక్కి గంటడం లేకపోతే సైకిల్ ఎక్కి పడిలింగ్ చేయడం అలాంటివి చేస్తే సరిపోదు. సో రిమెంబర్, డైలీ ఏదో ఒక టైం అందరూ చూస్తున్నారని సిగ్గుగానే మనకు ఉన్నట్టయితే తెల్లారి లేచిపోవడం, ఎవరో చూడకుండా నడవకి వెళ్ళిపోయి పరిగెత్తడం, జంపింగ్ చేయడమే, స్కిప్పింగ్ చేయడమే. సో అందుకోసం మనకి ఆడవాళ్ళు ఆడుకునే ఆటల్లో చిన్నప్పుడే స్కిప్పింగ్ని ఇంక్లూడ్ చేశారు. ఆ స్కిప్పింగ్ ఆడడం రెగ్యులర్గా చేస్తే పెళ్ళైన పెద్దవాళ్ళు కూడా స్కిప్పింగ్ ఆడుతుంటారు. అందుకోసం మన రిచువల్స్ వ్రతాలు, పూజలు వాటిలోని సాయంత్రం కూడా స్కిప్పింగ్ ఆడుతూ ఉండేవారు. పెద్దవాళ్ళు కూడా స్కిప్పింగ్ ఆడుతుంటాం మేము జనాలు చూస్తూ ఉండేవాళ్ళం మా గ్రామాల్లో. ఇప్పుడు పెద్దవాళ్ళు అయిపోయినాక బాగా ఒబెసిటీ వచ్చేసి ఇంకా స్కిప్పింగ్ వాటికి దూరం అయిపోతున్నారు. కానీ సో స్కిప్పింగ్ ఆ తాడుతో ఆడడం చిన్నప్పటి నుంచి మన వాళ్ళు అలవాటు చేశారు. సో దట్ ఈస్ పాసిబుల్ ఫర్ ఎనీ ఏజ్ గ్రూప్ ఇన్ ఎనీ టైమ్ ఆఫ్ ద టైమ్ ఇన్ ద హౌస్. So triglycerides in chylomicrons is degraded to free fatty acids and glycerol by lipoprotein lipase. This lipoprotein lipase is exercise based. Remember, రోజు కష్టపడి నడిచి స్కూల్కి వెళ్ళే వాళ్ళలో ఏ హైపర్ లైపోప్రోటీనియాలు రావు, ఏ హార్ట్ అటాక్లు రావు. వేరే చిన్నప్పటి నుంచి బస్సులు, బండ్లు, ఎక్కడికి చిన్న 10 కిలోమీటర్ల 10 మీటర్ల బండి తీసుకుని వెళ్ళే వాళ్ళకి lipoprotein lipase will be 0. So this lipoprotein lipase is synthesized by adipocytes and muscle cells. Remember this. So muscles బాగా వర్క్ చేయాలి, అది మీరు గుర్తుపెట్టుకోవాలి. It's associated with the luminal surface of endothelial cells of capillary beds of peripheral tissue. Deficiency of this enzyme is known as familial lipoprotein lipase deficiency. So this is known as type 1 hyperlipoproteinemia. So this type 1 hyperlipoproteinemia is due to the deficiency of familial lipoprotein lipase deficiency. This is a rare autosomal recessive disorder. Rare అనడానికి లేదు, ఇండియన్ కమ్యూనిటీస్లో విపరీతంగా కామన్. I told you, the Kshatriya communities, even in Brahmin communities, it runs in the families. ఎప్పుడైనా మనం హిస్టరీ అడిగినప్పుడు చిన్న వయసులో చనిపోయిన వాళ్ళు ఎవరైనా ఉన్నారా అనుకుంటే అప్పుడు దిస్ ఇస్ ద ప్రాబ్లమ్ అని తెలుసుకోవాలి. సో lipoprotein lipase and its coenzyme apolipoprotein C2 are deficient, resulting in fasting chylomicronemia and hypertriacylglycerolemia. సో ఫాస్టింగ్లోనే chylomicronemia ఎక్కువగా ఉండడం, ఫాస్టింగ్ లిపిడ్ ప్రొఫైల్ చేసినప్పుడు chylomicrons ఎక్కువ లెవెల్లో ఉండడం, సో VLDL కొలెస్ట్రాల్స్ ఎక్కువ లెవెల్లో ఉండడం. మామూలుగా 10 నుంచి 15 ఉంటేనే చాలా ఎక్కువ, 30, 40, 60, 70 కూడా ఉంటాయి అన్నమాట. సో ఫాస్టింగ్ chylomicronemia అండ్ hypertriacylglycerolemia మామూలుగా 3 digits లోపలే ఉండాలి ట్రైసైల్గ్లిసరాల్స్. అలాంటి వాళ్ళకి 200, 500, 1000 అంత కూడా ఉంటాయి అన్నమాట. రిమెంబర్, these are the things you have to remember. And you know pretty well, I need not tell this. Fate of free fatty acids is Due to the hydrolysis of triglycerides, the free fatty acids will be derived. They will be directly entering into the adjacent muscle cells or adipocytes, and free fatty acids can be transported into blood through serum albumin. So free fatty acids will be bound to the albumin. So most cells can oxidize free fatty acids to produce energy. Fatty acid oxidation we know pretty well. Adipocytes can re-acidify free fatty acids to produce triglycerides, which are stored until needed. So lipolysis and starvation. That is one application. And you know the fate of glycerol. Glycerol can be released from triglycerides and exclusively used by liver to produce glycerol 3-phosphate, and that will enter the glycolysis or gluconeogenesis. Two routes are kept for it, and they will be oxidized to dihydroxyacetone phosphate. So fate of remaining chylomicron component is, after most of the triglycerides are removed, the chylomicron remnants containing cholesterol esters, phospholipids, lipolipoproteins, fat-soluble vitamins, and some triacylglycerols. So they will be asking in the examination, what are the composition of chylomicron remnants? So chylomicron remnants contains cholesterol esters, phospholipids, lipolipoproteins, fat-soluble vitamins, and some very trace amounts of triglycerides also. So these chylomicron remnants bind to the receptors on hepatocytes, and after getting bound to the hepatocytes, they will get endocytosed. So they will be encapsulated and taken inside. So the remnants are then hydrolyzed to their component parts: cholesterol and nitrogenous bases of phospholipids, choline, and they will be recycled by the body. ఇది కొంతమంది ఎగ్జామినర్స్కి ఎందుకో ఫ్యాసినేషన్ అడుగుతారు. మరి అండర్ గ్రాడ్యుయేట్ లెవెల్లో మీరు అంతవరకు గుర్తుపెట్టుకోగలుగుతారో లేదో తెలియదు. అండ్ కొంతమంది నేను చూస్తున్నాను కదా, ఇన్ ద లాంగ్ రన్ ఆఫ్ మై ఎక్స్పీరియన్స్, సమ్ పీపుల్ కూడా ఫ్యాసినేషన్ చెప్తూ ఉండేవాళ్ళు ఇంకా ఇంకా అడుగుతూ ఆనందిస్తూ ఉంటారు. ఆనందించడమే, అదేమి సాడిజం అనుకుంటే కుదరదు. ఎన్నో అడిగారు సార్, అన్నీ చెప్పాను సార్, చెమటలు పెట్టేసాయి సార్, ఏడుపు వచ్చేసింది సార్ అంటుంటారు స్టూడెంట్స్. ఏమి అడిగింది చెప్తుంటే ఆనందపడుతూ ఉంటారు అన్న విషయం గుర్తించరా మీరు? ఇది సాడిజం అనుకుంటే ఎలాగా? సో అడుగుతారు, చెప్పండి. మరీ గుర్తు రాలేదనుకోండి, సారీ సార్, ఐ కెనాట్ రిమెంబర్, ఐ కెనాట్ రిమెంబర్ అన్నట్టు, ఐ కెనాట్ రికలెక్ట్ అని అనేస్తే చెప్పబోయేది. ఎవరు మిమ్మల్ని తెగే వరకు లాగరు కదా. In undergraduate level, most of the examiners are very friendly. So this is the small picture. Triglycerides, fatty acids, completely chylomicron formation, and to the tissues for utilization of fat in lymphatics. So this is also a small picture. Glycopolic acid. So you know, during the cephalic and gastric phases, stimulation by the vagal nerve fibers causes release of pancreatic juice. Acid chyme enters the duodenum and causes the enteroendocrine cells of the duodenal walls to release secretin, whereas fatty, protein-rich chyme induces release of cholecystokinin. You know pretty well, the cholecystokinin will influence the contraction of the gallbladder, and then the gallbladder will push out the consistent bile juice into the duodenum. You know, ampulla of water, you know, so ampulla of water will be there. There it will be released into the duodenum. So cholecystokinin and secretin enters the bloodstream at that place. So upon reaching the pancreas, cholecystokinin induces the secretion of enzyme-rich pancreatic juice. Secretin causes obvious secretion of bicarbonate-rich pancreatic juice. ఈ రెండు గుర్తుపెట్టుకోవాలి. ఏది దేనికోసం స్పెషల్. So I am once again reading so that you will pay some attention. Upon reaching the pancreas, cholecystokinin induces the secretion of enzyme-rich pancreatic juice. So secretion of enzyme-rich pancreatic juice will be influenced by cholecystokinin. So remember that. And then secretin causes copious secretion of bicarbonate-rich pancreatic juice. Pancreatic juice rich in bicarbonate will be induced by the secretin. So cholecystokinin ఒకదాని కోసం, secretin మరొకదాని కోసం. You have to remember this very clearly. So very clearly అని నేను 100 సార్లు ఎందుకు చెప్తున్నానంటే మీరు అవన్నీ గుర్తుపెట్టుకొని ఎగ్జామ్కి వస్తారు. థియరీ ఎగ్జామ్ ఉంది, వైవా ఎగ్జామ్ ఉంది, ప్రాక్టికల్ థియరీ వైవా అన్నది. So remember this. This is the digestive hormones in GI tract. Gastrin, cholecystokinin, secretin, vasoactive intestinal peptide. One ichar the example. 5 marks question. Gastric inhibitory polypeptide, GAP, motilin, somatostatin. So these are the 7 digestive hormones in the GI tract. So gastrin is number 1. Gastric antrum is the localization for gastrin hormone. In the G cells, ఈ సెల్స్ అన్ని గుర్తుపెట్టుకోవాలి. G cells, I cells, S cells, K cells, MO cells, ECL cells, D cells అన్ని స్పెసిఫిక్. ఒకదాని బదులు ఒకటి చెప్తే కుదరదు. So gastrin is localized in gastric antrum, that is known as G cells. So main physiological functions of the gastrin is to stimulate the secretion of gastric acid and intrinsic factor from the parietal cells. Parietal cells, oxyntic cells, ఇవన్నీ మీకు హిస్టాలజీలోనే, ఎనాటమీ, ఫిజియాలజీలోనే అన్నింటినీ బాగా 100 సార్లు స్ట్రెస్ చేసి చెప్పారు. మర్చిపోయినంటే కుదరదు. 10 సార్లు అడుగుతుంటారు. అడుగుతున్నప్పుడల్లా మీరు క్లియర్గా గుర్తుపెట్టుకోవాలి, తప్పులు గుర్తుపెట్టు. parietal cells. So they stimulate the secretion of gastric acid and intrinsic factor from parietal cells. And they stimulate the secretion of pepsinogen from chief cells. Pepsinogen from chief cells. So intrinsic factor from parietal cells. And they means fundamental. Aina marchipotuntaru, confuse ayipotuntaru. Confuse ayipotunna koddi chikaku padipotuntaru examiners. Rendu tittu tiruతారు. Tittu తినేసరికి మొత్తం బ్రెయిన్ బ్లాక్ అయిపోతుంది, టంగ్ టై అయిపోతుంది. ఇంకా అక్కడితోటి పతనం ఆరంభమైపోతుంది. కన్ఫ్యూజ్ అయిపోయింది సార్ అంతా వచ్చిందే సార్ అని నాలి కొడుకుంటారు, పెదవులు పరుచుకుంటారు. సో దట్ షుడ్ నాట్ హ్యాపెన్. యూ హ్యావ్ టు ప్రాక్టీస్ ఇట్ ఇన్ ద హౌస్. నౌ యూ ఆర్ వెరీ మచ్ స్టేయింగ్ ఇన్ ద హౌస్. సో మీ పేరెంట్స్నో, మీ సిస్టర్స్నో, మీ బ్రదర్స్నో ఇంజనీరింగ్ చదవని, ఏదైనా చదవని వాళ్ళని ఎదురుకుండా కూర్చోబెట్టి బాధేయండి వాళ్ళని. వాళ్ళు బాబోయ్ నమస్కారం అనే వరకు మీకు వచ్చిందంతా వాళ్ళకి చెప్పేయండి. సో దట్ యూ నో ప్రిటీ వెల్ హౌ టు డూ ద థింగ్స్ ఇన్ వైవా. So gastrin is localized in gastric antrum, G cells of duodenum. So main physiological actions are they stimulate the secretion of gastric acid and intrinsic factor from parietal cells, and they stimulate the secretion of pepsinogen from chief cells and promotes gastric and intestinal motility and mucosal growth. So cholecystokinin is known as CCK. Duodenum and jejunal eye cells, and G cells with eye cells. So stimulate the gallbladder contraction and stimulates release of pancreatic enzymes, relaxes the sphincter of Oddi. So sphincter of Oddi lo panchestadi cholecystokinin. Oddi annadu scientist anamata. Sphincter of Oddi is given the name of that histologist or anatomist. So relaxes the sphincter of Oddi for release of bile and enzymes. So the role in inducing satiety. So కడుపు నిండిపోయింది అనే ఫీలింగ్ రావడానికి కూడా cholecystokinin హెల్ప్ చేస్తుంటారు. ఇంకా వద్దండి, ఇంకా చాలండి అంటారు. ఏమి ఇచ్చినా ఇంకా కావాలండి అని చూస్తూ ఉంటాం. బట్ కడుపు నుండి అన్నం పెట్టేస్తే ఇంక చాలండి అని అక్కడ ఒక్క దగ్గరే వస్తుంది. అందుకే కడుపు నుండి అన్నం పెట్టడం గొప్ప పుణ్యం అంటూ ఉంటారు. Secretin, duodenum is the place, and duodenum and jejunum are the places for secretin. S cells produce the secretin. So the main physiological action is they stimulate the secretion of bicarbonate from pancreas and inhibit the gastrin and gastric acid secretion. Vasoactive intestinal peptide, VIP. So it is localized in enteric nerves. It increases the water and electrolyte secretions on pancreas and gut. It relaxes the smooth muscle via nitric oxide, NO, of the gut. So remember, nitric oxide of blood also is most important, NO. Remember the difference between nitric oxide and nitrous oxide. Nitrous oxide inoperable is the laughing gas. Induction of anesthesia will be done by the nitrous oxide. Whereas nitric oxide is nitric oxide synthase enzyme దాన్ని promote చేస్తుంది. So I told you about the great length about this nitric oxide. So gastric inhibitory polypeptide is GIP, produced by the K cells in duodenum and jejunum. So they reduce the gastric acid secretion and intestinal motility and stimulate the insulin release. So motilin throughout the gut, MO cells and ECL cells are localized for this secretion of motilin. So they increases the small bowel motility during the fasting and the gastric emptying also. And this motilin is present throughout the gut. Somatostatin, this is most important in the stomach, small intestine and pancreas, D cells. So they inhibit the secretion and action of many hormones, including all of these digestive hormones in GI tract. So this is what is repeated. So physical findings in hyperlipidemia. So corneal arcus. Around the cornea, you will be finding corneal arcus. You know something about arcus senilis, brown ring. That is for the people like me, above the 65 years of age, you will find arcus senilis. Whereas this corneal arcus is different. In hyperlipidemia, corneal arcus will be seen even for small children about 20, 30 years. So whenever we are going to marry somebody, you have to look into their eyes. If they are having arcus senilis, he is an old man concealing his age. If he is having corneal arcus, he is a man with hyperlipidemia, not going to live with us after marriage. Both are dangerous. You should have enough of the biochemical knowledge. And lipemia retinalis, this can be done by only by retinoscopy only. And jantilasma. So కన్ను మీద చిన్న చిన్న ఆయిల్ లాంటివి రావడం, ఎవరినో దేనికోసం ఇస్తానని చెప్పి మురిపించి ఇవ్వకపోతే ఇలాంటివి వస్తాయి అని అంటూ ఉంటారు. బట్ దట్ ఇస్ నోవేర్ కన్సర్న్ విత్ దట్. It is jantilasma on eyelid. So that will be seen in hyperlipidemia cases, even in the early stages. If it happens in the old age, it is nothing to be concerned. దాని పెద్దగా మనం వరి అవ్వక్కర్లేదు. పెద్ద వయసులో అలాగే హైపర్లైపిడీమియా ఉంటాయి. సో కన్ను రెప్పల మీద అలాంటి చిన్న చిన్న కాయలు లాంటివి వస్తే పెద్ద వయసులో పెద్ద ప్రాబ్లం పెడతారు. చిన్న వయసులోనే వస్తే మాత్రం it is something concerned with the hyperlipidemia. So remember, corneal arcus, lipemia retinalis, xanthilasma on eyelid. These are all most important things. These are the things that we have to be careful about choosing the diagnosis. Second thing, tendon xanthomas. You will find wherever tendons are there, you will find the xanthomas. Or the Achilles tendon also you will find big xanthomas. And tuberous xanthomas or the knees will be seen. ఇది ఏదో అని చెప్పేసి కట్ చేయించేసుకోవడం, ఇంకేవో చిన్న చిన్న ఆయింట్మెంట్లు అవి అంటించడం, ఇవన్నీ వెరీ డేంజరస్. స్కిన్ అంతా యాబ్సెస్ అయిపోతాయి, పెద్ద పెద్ద ప్రాబ్లమ్స్ అయిపోతాయి. Eruptive xanthomas or the axilla, you see the axilla. So a large number of eruptive xanthomas will be seen over the axilla. So tendon xanthomas over the Achilles tendon on the leg there. Tuberous xanthoma over the knee. Eruptive xanthoma over the axilla. ఈ మూడు పేర్లు దయచేసి గుర్తుపెట్టుకోండి. ఎగ్జామినేషన్లో అడుగుతారు. Vaivalo adutar. So physical signs of hyperlipidemia are tendon xanthoma, tuberous xanthoma, eruptive xanthoma. Usable మూడు కూడా గుర్తుపెట్టుకోవాలి. కార్నియల్ ఆర్కస్, లైపీమియా రెటినాలిస్, xanthelasma on the eyelid. ఆ మూడింటితో పాటు టెండాన్ xanthomas, tuberous xanthomas, eruptive xanthomas ఈ మూడు కూడా గుర్తుపెట్టుకోవాలి. ఎస్పెషల్లీ ఈ eruptive xanthomas or the axilla అసలు కనిపించవు. సో ఏదో టెండాన్ xanthomas ఫుల్ హ్యాండ్స్ వేసుకుంటే కవర్ అయిపోతాయి. ట్యూబరస్ xanthomas ఫుల్ హ్యాండ్స్ ఫ్యాంట్ వేసుకుంటే కవర్ అయిపోతాయి. ద పీపుల్ హూ నెవర్ వేర్ హాఫ్ హ్యాండ్స్, ద పీపుల్ హూ నెవర్ వేర్ షార్ట్స్, వాళ్ళలో ఇవి ఉంటాయేమో చూసుకోవాలి. ట్యూబరస్ xanthomas over the knees, టెండాన్ xanthomas over the Achilles tendon. సో ఇలాంటి వాటిలో eruptive xanthomas over the axilla. సో కట్ బనియన్స్ వేసుకోవడం అలవాటు ఉన్న వాళ్ళు ఇవి కనపడతాయి. అది కాకుండా ఫుల్ హ్యాండ్స్, హాఫ్ హ్యాండ్స్ బనియన్స్ అలాంటివి వేసుకున్న వాళ్ళలో eruptive xanthomas will be hidden. So be intelligent in diagnosing the cases. So especially when the heart attacks runs in the families, you need to be careful about these external symptoms. So risk factors in the family and in the food. FF, food and family. These are the main risk factors. But all settled and exercise food on. So remember, therapeutic agents are niacin and hyaluronic acid. So remember, so gemfibrozil, low peak, fenofibrate, tricor. These are the two names of hyaluronic acid. So guర్తుపెట్టుకోండి, niacin and hyaluronic acid. These two are very important therapeutic agents for lowering the lipids. And bile acid resins. So you know, cholesterol, it is available in the market as cholesterol, and cholestyramine available in the market as Vestron. And statins, they competitively inhibit the HMG-CoA reductase, the committed step of cholesterol biosynthesis. So they are available as atorvastatin, fluvastatin, lovastatin, pravastatin, simvastatin. And the market names for this is atorvastatin is available as Lipitor, fluvastatin is available as Lespor, lovastatin is available as Nevacor, fluvastatin is available as Pravacor, and simvastatin is available as Jocor. So remember the statins. So fungal agents, statins are nothing but fungal agents. So you know pretty well about this atherosclerosis, plaque formation. So causes of hyperlipidemia are diet, hypothyroidism. Remember, this is one factor you should never forget. Whenever we find hyperlipidemia, you should not jump into the conclusion. We have to test for hypothyroidism. And hypothyroidism is quite common in Indian scenario, tropical countries, in tribal areas where the people live in high altitudes. ఇన్ని కేసెస్ 100 మంది మనుషులు చూస్తే 30 మంది హైపోథైరాయిడిజం కేసెస్ కనపడతారు. When I used to go for the camps, I used to group all the hypothyroidism people at one place, and I used to take photographs of these people. You can ask our seniors. So we had many photographs of such clinical photographs in the field. So nephrotic syndrome is one more problem. In nephrotic syndrome, there will be hypercholesterolemia. Anorexia nervosa, ఏమీ తినకుండా వచ్చి ఎండిపోయిన మునంకాడలా అయిపోయిన వాళ్ళలో కూడా anorexia nervosa leads to this. Obstructive liver disease, obesity, diabetes mellitus, and pregnancy also will come across with hyperlipidemia. Obstructive liver disease, acute hepatitis, systemic lupus erythematosus, AIDS, protease inhibitors. When they are using protease inhibitors, it will lead to hyperlipidemias. So dietary source of cholesterol, monounsaturated fat. The main source is olive oil, olives, canola oil, peanut oil, cashew nuts, almonds, peanuts, and most other nuts, avocados. Luckily for us, we are not having this avocados. We are now getting it, of course. So monounsaturated fats are the source for cholesterol. So the effect on cholesterol, they lower the LDL but raises the HDL. This is a good one. Polyunsaturated fatty acids lowers the LDL, raises the HDL. They are present in corn oil, soybean oil, safflower oil, cottonseed oil, and fish oils. Saturated fats, they raise both LDL and HDL. So they are present in whole milk, butter, cheese, ice creams, red meat, chocolate, coconuts, coconut milk, coconut oil, egg yolk, and chicken skin. That's why skinless chicken తినడానికి మన వాళ్ళు కొంత ఇన్సిస్ట్ చేస్తుంటారు. ఏం చేసినా నాన్ వెజిటేరియన్ is having full cholesterol. So they rises both LDL and HDL. And trans fatty acids. మీకు చాలాసార్లు షార్ట్ నోట్స్ అల్ట్రా షార్ట్ నోట్స్ ఇచ్చింది. So trans fatty acids, they will be contained in margarines, vegetables, vegetable shortenings. అన్ని తింటారు, వెజిటబుల్స్ మాత్రం తినరు. So partially hydrogenated vegetable oils, hydrogenation of vegetable oils will convert them into solid things, margarines. So deep commercial baked goods, so deep fried chips, many of the fast foods. అందులో ఇంకా ఇది లేదు అది ఉంది అని అనడానికి లేదు. ఫాస్ట్ ఫుడ్స్ ఏవైనా సరే gold and trans fatty acids. So most of the commercial baked goods, they raises the LDL. That's why it's dangerous. Remember, so the effect of monounsaturated fatty acids are, at least to some extent, they will lower the LDL and they will try to raise the HDL, provided we do regular exercise. Regular exercise is most important. Either up to chesante kudaru. Polyunsaturated fatty acids lowers the LDL and raises HDL. Saturated fatty acids raises both LDL and HDL, most dangerous. అందుకే the Thiruvananthapuram question was reported. So Kerala people, they will have quite frequently heart attacks. So I was the examiner for Amrita Medical College. The Amrita Medical College is being run only by the heart attack patients. So heart attack patients are many problems. So remember this. Listen, Rasa, next question. So these are all the xanthomas. Remember, xanthomas classically appear, originally appear like this. So wherever you find such a fellow coming to see you for getting your hand in marriage, don't take his hand. That is the most dangerous hand. So they will just die after marriage. Once you marry such a fellow, he is going to die after marriage. So you have to, when they cover the hand with full sleeves, ask them to uncover the hands up to the elbow, up to the knee. That is most essential. No, I am telling the class. So remember, this is most important. Okay. So you see this. So when signs and symptoms of hypertriglyceridemias, more than 4,000 milligrams per deciliter, weak appearance of veins and arteries of the retina, 5,000 milligrams per deciliter of acute pancreatitis, pain in the abdomen, so acute abdomen, and accumulation of chylomicrons within the macrophages up to more than 1,000 milligrams per deciliter. So signs and symptoms of hypercholesterolemia, xanthelasma and corneal arcus. That is, both of these two things are not significant in elderly people. For young people, this is most significant. Xanthelasma, if you find in young people, corneal arcus, if you find in young people, they are going to live short. So block in the arteries, major risk for CVD, coronary vascular disease, including myocardial infarction and stroke, as well as total mortality. They will die within 30 days. So fish oil, omega-3 fatty acids, decrease the triglycerides by 20 to 50%. So long-term intake results in increase in HDL loss. So fish oil is important. Hereditary causes of hyperlipidemia, familial hypercholesterolemia, co-dominant genetic disorder, co-occurs in heterozygous forms, occur in 1 to 5,000 individuals, mutation in LDL receptor, resulting in elevated levels of LDL in birth and throughout life, high risk for atherosclerosis, telangiectasiomas in 75% of patients will be come across, tuberous xanthomas and xanthelasmas of the eye also will be seen in familial hypercholesterolemia. Familial combined hyperlipidemia is autosomal dominant condition. Increased secretion of VLDLs will be seen in lipid profile. This beta lipoproteinemia affects 1 in 10,000 people, results in ApoE2, a binding defective form of ApoE, which usually plays important role in catabolism of chylomicrons and VLDL. So remember all these things: medical complication of obesity, so pulmonary disease, abnormal functions, obstructive sleep apnea, నిద్రలో గురకపెట్టడం, non-alcoholic fatty liver disease, gallbladder disease, gynecological abnormalities in PCOS, phlebitis, cancer, coronary heart disease, stroke. Rama.